thyroid, sinusitis is the inflammation of the nose and the air cavities beside the nose, which we call the sinuses. There are openings that connect to the inside of the nose. So when there's inflammation, both areas become inflamed together. It can be caused by many factors. It could be due to infections from bacteria, viruses, or even fungi. Any of them can cause it. When bacteria accumulate in the sinuses as a biofilm, this can also lead to chronic sinusitis. Generally, this causes symptoms like nasal congestion and a runny nose, but for some people, the mucus drips down the back instead, meaning it goes down into the throat more, which leads to a sticky feeling in the throat. There can be phlegm going down the throat, which may be cloudy or even greenish. Some people experience pain around the eye sockets or in the facial area. Some people feel a throbbing sensation around the eye sockets, which can be confused with migraine. Some experience pain radiating to the cheek area. This can make them think they have tooth decay. Some people notice abnormal smells. Their sense of smell may be reduced, or they might notice a foul smell in their nose. Especially in children, they often present with a chronic cough. In cases of acute sinusitis, it usually occurs after having a cold, that is. After catching a cold, there is swelling and inflammation. The infection can then spread into the sinuses, but if it lasts for more than 3 months, it's called chronic sinusitis. The symptoms are quite similar, but in most cases of acute sinusitis, the patient will have symptoms for only a short period and sometimes may also have a fever. And sometimes there will also be nasal congestion. A runny nose is more prominent, but in chronic cases, the patient will have had nasal congestion for a long time. Some people don't really pay much attention to this symptom. They get so used to breathing through their mouth that they focus more on the sensation of phlegm in their throat. A sticky feeling in the throat or headaches or facial pain are more common, and especially abnormal sense of smell as well. Sinusitis can significantly affect your quality of life because it leads to poor sleep, difficulty breathing comfortably. It causes tiredness and fatigue, and when you wake up, you can't focus on your work. This affects your work and can even lead to depression. Sleep issues can also contribute to sleep apnea. Patients with blocked or narrowed airways can experience snoring, which can lead to breathing pauses. Oxygen levels drop, and this causes frequent awakenings during the night. In this case, it can have long-term effects, leading to heart disease and stroke. It can also spread to the eyes and cause blindness, and it can spread to the brain, resulting in a brain abscess. Generally, sinusitis doesn't turn into cancer, but many mistake a tumour for it. Symptoms like congestion, a runny nose, and facial pain often improve with antibiotics, so people skip checkups, unaware of the underlying cause. Never even had an endoscopy. Later, their condition worsens. The nasal congestion becomes more severe. It turns out that when they finally have an endoscopic examination, a mass is found in the nasal cavity and sinuses. They then assume that sinusitis has developed into a tumour or even cancer. In reality, they may have already had a mass, but sometimes it blocks the sinus opening, causing repeated inflammation. Normally, sinusitis can be treated in several ways. It depends on what type of sinusitis it is. You need to distinguish between them first. If it's acute sinusitis, which is generally caused by an infection, it will be treated with antibiotics and any medication that helps the sinuses to drain. Most of the time, it can be completely cured. But in cases of chronic sinusitis, treatment involves using nasal sprays, nasal irrigation, and taking medication. Antibiotics might help, but if it's not an infection, they won't be used. Distinguish between them first. Tooth decay can also cause sinusitis, so you need to treat the teeth as well. Some people have sinusitis with nasal polyps, which should be treated with surgery. The surgery is different from other types. It involves opening up all the sinuses to make them wider, so that after the operation, medication can be flushed into the sinuses more effectively, because it requires long-term control. The endoscope is actually used both for diagnosis and for treating the sinuses. Nowadays, 90% of surgeries are performed using an endoscope. There will be no scars on the face. It's better than in the past because back then, whenever there was a wound, it would be on the face, which was a real pain point, wasn't it? No one wants to have a scar on their face, that's for sure. When patients come for an outpatient checkup, an endoscope examination is done first. For those who need surgery, preparation with a CT scan is required. Normally, during surgery, general anaesthesia is required to keep the patient still and pain-free. The operation itself involves using a camera to look inside, along with small instruments specially designed for sinus surgery. If it's a complicated case, a resistor and a navigator are needed to guide the surgery, just like when you drive in a car. Wherever we are, it will show up on the quart image, indicating exactly where we're operating. This helps to reduce complications and also allows for a more complete removal of the tumour during surgery. After the operation, patients usually stay in hospital for about 1 to 2 days and can get up and walk around as normal. There may be some pain. Nowadays, it's not only patients with allergic rhinitis who develop sinus disease, because the environment doesn't just contain allergens, but also increasing pollution, including PM2.5 and other toxins present in the air. If, for example, we have allergies, we should avoid our specific allergens and manage our allergies well. Rinse your nose regularly. In cases where you are in an environment with pollution, try to pay a bit of attention. If, for instance, you need to go outside on a day when pollution levels are quite high, it's recommended to wear a mask that can filter PM2.5 particles. If anyone has any questions about nasal and sinusitis conditions, you can come for a consultation at the Otolaryngology Centre. At Vimut Hospital, we have a team of specialist doctors who have experiences in nasal and sinus conditions, ready to provide you with dedicated advice in this area.